Hi, this is Craig Robinson from Robinson and Casey. Some of the questions that we typically get at Robinson and Casey during times that families are considering the Marchman Act and during the Marchman Act process is, does the Marchman Act force sobriety? And does the Marchman Act really work? These are really difficult questions to answer oftentimes for our families. But the best way that I can put it is this, is that when families typically come to us and are considering a Marchman Act, what's really happening is they've run out of hope. And this is a common problem for families that are going through a situation where a loved one is suffering from a substance use disorder and co-occurring mental health disorder, or a significant mental health disorder without a substance use disorder, is that they have been going through a continuous and repetitive cycle for a long time. And there has been no long-term solution provided to the family. And really what the family is looking for at that point in time when they're in crisis is for a peaceful night's sleep and really an opportunity for their loved one to actually get sober and get well and stay sober. And that's really what the Marchman Act and even guardianship as well really can provide to the family. It's not about forcing sobriety. At some point in time, obviously, that willingness that an individual with a substance use disorder needs to get well and stay well needs to develop. And I will say that what we have seen at Robinson and Casey is that when an individual is placed into a setting where they're around great quality clinical care and they have that opportunity, sometimes the hardest part for an addict is actually asking for help and admitting that they need help. It's really the first step in recovery is honesty about the situation, honesty about their addiction, and honesty about the consequences that have been caused by it. And that is one of the hardest steps for an addict to take, is actually to ask for help and to admit that they actually have a problem and to seek help. But given how difficult that first step is to take, oftentimes what an individual suffering from that needs is kind of a nudge in the right direction. And that's really what the Marchman Act provides. It takes that need to actually ask for help out of the addict's hands, and it places it into the court system's hands to actually make that decision for them. Florida law specifically states in the Marchman Act that for an individual to meet Marchman Act criteria, they have to be incapable of appreciating their own need for treatment or making a rational decision with regards to their own need for care. That is one of the hardest things for an addict to understand, because most of the time they lack the capacity to make that decision and to appreciate their own need for care. And so the best way I could put it is that this law really provides that hope and that opportunity to families when they otherwise don't have it.